So the way that I structure my exams for this class, it's different than intro, okay? So the way that my exams are structured is I am generally going to give you basically a myriad of questions that are generally either multiple choice, right? And then, some going to be multiple choice, maybe sometimes short answer, right? And or I will give you a picture, right, on the exam and expect you to label anatomy. Okay, so that's kind of what you're going to see in the multiple choice area. Okay, in that first section. Then I pretty much always try to finish my exams off with 2 to 3 essay questions. All right, generally what those are about or composed of are generally more critical thinking questions about the information that we've covered. Oh my gosh, sorry, my dog, I thought my dog was dying for a second. He was laying next to me making weird noises. But those essay questions are generally constructed asking you questions about, in this case, maybe the importance of soap notes, or what, how you might elicit a history from a patient that you think has a specific pathology. Okay, so it's going to require you to think a little bit and write your thoughts down. Okay, so, but generally speaking, I try to keep all my exams consistent. Okay, so you'll always have the multiple choice questions, maybe some anatomy labeling, and then essays. I try not to throw too many curveballs, and I try to be predictable and consistent. Anyway, so that's kind of how I roll in that regard. All right, any questions there?
For the tests, are they timed?
No, they're not. I do not time my tests. Okay, the reason for that, well, when you take your VOC, you do have a time limit there, but the bottom line is that I want you guys to think through these questions, because some of them will not be easy questions, and I want you to have time to think. And I think if you have a timer in front of you, it just freaks you out, you get anxious, and then you screw up. I mean, really, truthfully, if you know you're being timed, you're going to rush, and then you're going to make mistakes. If that makes sense. All right. So yeah, but I don't put time limits on my exams. Okay. Whoops. Here, let me share my card here. I swear I've been using Zoom for consistently a while now, and I feel like every time I'm like a 5-year-old. I can't seem to, oh, come on, get it right. There we go. Very nice. So guys, this is going to be today just a very basic overview of the foot. Obviously, there's going to be a lot of anatomy that we're going to discuss in further detail in the coming days. We're going to get a lot of practice with palpation, okay? But this is just going to be kind of like a little teaser and kind of an introduction to the foot. All right, now I think I'm sharing. Come on. There we go, perf. Ah, cool. Okay, guys, so foot and toes, here we go. So generally speaking, right, this is our first, and by the way, don't worry, I will post this on Moodle, so that'll be up. Don't worry about, feverishly writing notes unless you want to. Okay, so the foot, guys, okay, this is one of the most probably, it's one of the most anatomically complex, right? We have 26 individual bones, right, that make up the foot. Between the phalanges, between the metatarsals, and between the tarsals, we've got 26 bones in all, right? And usually we split up the foot into 3 regions. And you guys are going to get to see how these regions interact with each other. Okay, we have the forefoot, the midfoot, and the rear foot. Okay, so starting really with the forefoot, right? We have 14 phalanges. By the way, and I, not to, insult anyone's intelligence. I know you guys have taken anatomy and biomechanics. When I say phalanges, what am I referring to?
Toes.
Toes, right? Absolutely. So obviously, each toe, okay, has an individual phalange and or phalanx. Okay, know the word phalanx too, because if you look at a toe, you'll notice that it has obviously, the 2nd through 5th toes have a distal, middle, and proximal phalanx. The big toe or the great toe only has 2, right? And then obviously 5 metatarsals, 1 through 5, obviously starting with the most medial at the big toe and moving laterally. And then we have 7 tarsals, okay? And the tarsals specifically are the first, second, and third cuneiforms, the navicular, the cuboid, the talus, and the calcaneus, okay? I know I blitzed through that, but don't worry, I'm gonna explain that, okay? All right, here we go. And these are kind of the Latin names, okay, that are typically ascribed to these bones. But let's break it down. So you can see the forefoot here, right? Obviously, the forefoot obviously is comprised of the phalanges and the metatarsals, okay? So we have obviously the first, so if we look at the first metatarsal here, so if we look over, you see the number 1 here on the screen, okay? That bone is your first cuboid. I'm sorry, your first cuneiform, actually. First cuneiform, right behind that's your navicular, okay? But if we move up from number 1, first metatarsal, okay? Then we have our first phalange, right? So we have our proximal phalanx or phalange and our distal phalanx, okay? If we move laterally, okay, second toe, we have a proximal, we have a proximal, middle, and a distal phalanx. Okay, and we can see also toes 3, 4, and 5, the same thing going on. Proximal, middle, and distal phalanx. Okay, now here's the deal. Okay, if we look at the metatarsals, okay, and we see metatarsal number 1 here, okay, right, lining up with the big toe, 2, lining up with the middle toe, 3, okay, lining up with toe number 3, 4 lining up with toe number 4, and 5 on the outside. Okay, so medial to lateral, 1, 2, 3, 4, and 5. So that's the forefoot. Okay, the forefoot is generally, I would say, compared to the rear foot, that's the second most mobile area of the foot. The vast majority of the motion in the foot is going to occur at the rear foot, which is composed of the talus and the calcaneus back here. All right. Now, the midfoot, though, okay, is composed of obviously our cuneiforms, first cuneiform, second cuneiform, third cuneiform. Directly behind the cuneiforms is the navicular. And then on the lateral side, okay, is the cuboid. So first cuneiform, second cuneiform, third cuneiform, cuboid, navicular. All right. And then obviously we have our talus, number 7, right? And our calcaneus. All right. And don't worry, you guys, we're going to go over all of this again. We're going to teach you guys how to palpate it, identify it. So once again, this is just a basic introduction. Okay. So we do have these bones, though, and I want to point something out to you guys called sesamoids. Okay. What in the world, and actually, who can tell me what is a sesamoid bone, first of all? What is it? What is it, and what does it do? Any ideas? Okay. So a sesamoid bone, guys, is formed by friction. By the way, you guys, I'm sorry for that background noise. I have this crazy son of a gun down here laying next to me, chewing on a ball, and it's ridiculously noisy. No respect whatsoever from this guy. He doesn't care at all. Okay, so if you look really closely here, you guys can see my cursor. You see these two tiny little circle things? So we're looking at the foot from the bottom. Okay, this is an x-ray of the foot taken from the bottom side. All right, now, if you look here, we have the first metatarsal. Here it is on x-ray. If we come up on the first metatarsal, we're gonna see these two little tiny circular bones right here. All right, those are sesamoids. Now, a sesamoid develops because of friction. Okay, so for example, another example of a sesamoid bone is the patella in the knee. So as babies, crazy times, the next time you're holding a newborn, just feel for that patella. It's not there, right? You're like, this baby has no kneecaps, bro, right? This baby, so seriously, feel on a little baby. All you're going to feel is a tendon, right? Particularly if they haven't started crawling yet, you're going to feel maybe just a tiny little kind of cartilaginous knob, but that patella will not be fully developed, right? And even absent, right? But once they start crawling and putting friction across the front of that knee, that sesamoid bone develops and starts to get bigger, okay? That is also how the sesamoids develop. They develop due to friction placed on the foot over time as we learn to walk. So anatomically, why are they important? They're important because these two little bony knobs at the bottom end of the metatarsal provide a tunnel, right, for the tendon, right, for the flexor hallucis tendon to glide through. If not for those bones to provide that tunnel, the flexor hallucis tendon would not be able to follow a straight line of pull. So that bone, the sesamoid bones, are keeping that tendon pulling in a straight line. Okay, that's the purpose of a sesamoid. So, or at least here in the foot, right? And actually also in the knee. The patella is used to create a fulcrum for knee extension. So loud. Okay, so what about arches? Okay, we have arches in the foot. We have 3 of them. So obviously, what do we think, by the way? Okay, because all of us actually have, different makeup when it comes to what our arches look like. And we're gonna learn how to assess that. Some of us have flat arches. Some of us might be pronators, right? Meaning that our medial longitudinal arch has essentially lost some of its structure and the inside of our foot falls too far towards the ground, okay? So we have a medial longitudinal arch. We have a lateral longitudinal arch, okay? So we have one longitudinal arch on the inside, one on the outside. And then we have a transverse metatarsal arch that runs across the foot this way, okay? And so 3 arches in the foot. Now, it's snowing. What do you think? What do you think the arches are supposed to do, guys? What do you think they do?
Is it for impact, like on the walking cycle?
Okay, so they help us obviously absorb impact and dissipate force, right? Extremely important. And they also help, along with some of the ligaments surrounding them, maintain the biomechanical, essentially an anatomical makeup of the foot. But their main job, is to absorb impact as we walk through the gait cycle. Okay, good. All right. So here's the deal. Okay, we have really important bony structures in the foot, and we're not going to get into the specifics of a lot of these today, but I'm going to give you a couple of examples. Okay, knowing the bony anatomy of the feet, right, is extremely important. The reason for that is knowing which bones are which is going to provide us with essentially with an anatomical map, right, of knowing which tendons attach where, and knowing also which soft tissue structures attach in other places, right? And so if we know our bony anatomy, we're going to be able to do a lot better job at essentially coming up with diagnoses for foot pathologies. So what's an example of that? Excuse me. An example of that, okay, is the 5th metatarsal. So the 5th metatarsal at its base, and I'm going to draw a picture here because that's always fun to do. Okay, I'm going to go to my whiteboard for a second. The 5th metatarsal. Perfect. So here are my metatarsals. Okay. 1, 2, 3. Move this guy out of the way so I can keep drawing here. 4. Okay, and 5. Okay, now here's the deal. The reason why knowing these structures is incredibly important. I have a tendon. Okay, I have actually tendons that come off of my peroneal muscle on the outside of my lower leg, and the peroneus brevis tendon is going to whoops, is going to come down, right, and attach directly on the base of my fifth. Knowing that that attaches at the base of the fifth metatarsal is going to really help me, because there are situations in which, either with a very rapid muscle contraction or potentially even with a severe ankle sprain, right, this tendon can become stretched and either tear or be injured, right? Or conversely, all right, it can either tear and be injured, or it can actually evolve the base. Okay, so knowing my bony landmarks and what attaches on them is ridiculously important for the foot. Okay, all right, cool. So another example of that, I'm going to clear my drawings here, is the talus. Here's my talus. I'm going to draw my talus here. Okay, it looks like from an anterior view, it looks like this. Okay, and there's my tibia and my fibula coming around like so, forming that ankle mortise. Okay, now if I'm looking at my talus from the medial side, here we go. Here it is. All right, I have a bony landmark on my talus, known as the sustentaculum tali. All right, and don't worry, I'm going to teach you all of this, so don't freak out. Right, it's like my favorite thing to say when we're learning anatomy, so don't freak out. Right, we have the plantar fascia. This is actually the point of origin for the plantar fascia. Okay, the plantar fascia is essentially a fascial structure that runs into the bottom of the foot, right, and has several attachment points down towards the base of the metatarsals. All right, now the reason why knowing that the sustentaculum tali is an important bony structure that we have to be able to palpate is because oftentimes people with plantar fasciitis will have pain at that anatomical landmark. Okay, so yet again, another example of why knowing your bony anatomy in the foot and ankle is key, right? Key. All right. But, okay, whoops. Shoot. You guys can still see my screen, yeah? All right. It's a yes. Okay. Okay. All right. So what about though? Now, what about biomechanics? Okay. The other thing that we're going to learn about and talking about the foot is the importance of biomechanics. All right. So we just said, right, if you guys remember, that the foot itself is broken down into 3 sections. What are those sections? Who remembers what they are? I've got 3 of them.
Forefoot, the midfoot, and the rear foot.
Bingo. Okay. Now, if you see this picture, okay, what you can see is that I have, okay, obviously my talus and my calcaneus, making up my rear foot, have more motion, excuse me, than any other segment of the foot, right? But if my talus and my calcaneus are not appropriately aligned, okay, within the foot, that is actually going to cause biomechanical abnormalities, not only at the midfoot, but also at the forefoot. Okay, so for example, we can see here on this far left picture, right, that the...
You guys see his screen?
Oh,
It was
shoot.
there and then it went away for me.
Oh, you can't see it? Lizzie, I'm sorry. Let me
It
share
was
it again.
there for a second and then it went away.
And then it went away. Okay, my bad. What about now?
Oh, it's beautiful.
Sorry, guys.
Perfect.
My bad, my fault. So I'm glad you guys can see that now. Okay. Okay, so, all right, here we go. If we look at the foot, right, is this gray circle, okay, essentially is my talus, right, and my calcaneus lies right underneath it and behind it, okay, but ultimately, like we said, I have the most motion at the midfoot than any other section of the foot. That's where it's going to move the most, okay. Now, if my rear foot, okay, deviates medially, okay, what that's going to do, you can see how that's actually going to cause, you see how the inner arch of my foot here looks like it's almost kind of like sagging in toward the, you see this picture on the far left? How it looks almost kind of like it would be almost touching the floor. Okay, that's going to actually contribute, okay, to something that we call excessive pronation. All right, and the one thing that we're going to learn that I'll teach you guys, and it's gonna be crazy fun. We're gonna have a day where we actually do some orthotic impressions for the feet. It's gonna blow your minds. It's gonna be so much fun. Okay, but it's extremely important to correct and control rear foot motion, right? And so ultimately, I'm gonna do a little bit more drawing here because I like to draw. All right. So, okay, I've got my rear foot, midfoot, and my toes. Okay, but ultimately, as you can see, okay, if my rear foot, okay, ultimately deviates, right, medially, okay, what this can actually cause is a condition called pronation. Okay, and we'll talk about that more in a second. But if I were to all of a sudden correct and put in neutral my rear foot, okay, what that then does is it corrects the biomechanical axis of the foot. Okay, so the biomechanical essentially, so we have ultimately, I'm going to go ahead and clear this out. All right, so the foot itself, right? So the foot, okay, the rear foot, type, okay, can either be in a valgus position or a varus position. Okay, so this deviates inward or medially. Okay, rear foot varus. Okay, so do you, first of all, as we're kind of talking about this, do you guys understand what I say? Because remember, these compartments move kind of on their own, but they affect one another, right? Do you see how the rear foot could potentially be in a position of essentially varus or valgus? Does that make sense? Potentially how that could happen? Yeah, I'm getting maybe some nods. Kind of makes sense, Wade, but this is kind of getting a little crazy here with your drawings and your typing, bro. Okay, makes sense? Okay. So, and this is going to make more sense when we actually see this on each other. The one thing I would recommend, guys, because we're about to start doing actually more palpation and stuff like that, and to learn this anatomy and learn attachments and that kind of thing. So if you guys look on the syllabus for this week, right, the one thing now that I'm wanting you to do is crack open that trail guide. Okay, look in the trail guide, and you're going to need to start going through this anatomy and learning it, right? Because we're going to start actually working on palpation. Okay, how many of you guys have that trail guide? Yeah, we got it. Okay, good. You're going to need to start using it. Okay, so we got the rear foot. Okay, obviously, if we have a change in the rear foot, okay, then we have the midfoot. Okay, my midfoot, generally speaking, in response to the position of my rear foot, can either pronate, so, or it can supinate. All right, so my arch, okay, my medial longitudinal arch. Okay, so pronation, my medial longitudinal arch falls toward the floor. Okay. Okay, with supination, okay, my medial longitudinal arch is high. Okay, don't worry. We'll show you examples of that. Who has, or who's been told, by the way, in class that they have high arches? Anybody been told they have high arches? Maybe. Who's got flat feet? Anyone have flat feet? Maybe. Okay. So ultimately, here's what I'm saying, right? You guys might want to show your feet a little extra love over the next couple of weeks because your classmates are going to be seeing your feet. Okay. I know, potentially kind of nerve-wracking for some folks. Sorry about that if that's the case. But we got to do a little bit of palpation. So show your feet a little extra love. You know, get a pedicure, lotion up, do what you got to do. Okay. Because it's gonna be time to get down and dirty with the feet. All right. All right, and then we obviously have the forefoot, guys. So the forefoot, okay, also can either also go into varus or valgus. Okay. Okay, but the movement at the forefoot is much more subtle. Movement at the forefoot is much more subtle. Brr, sorry. Okay. All right. So cool. I'll let you guys get that down before I take it away. This is being recorded and I will post this on Moodle along with the PowerPoint. Okay, let's review. How many bones do I have in the foot? What was that?
26.
Okay. How many phalanges do I have?
14.
Perfect. How many metatarsals do I have?
5.
5. Okay. How many tarsals do I have?
7.
Okay. What 2 bones make up the rear foot? Very good. Okay. What tarsal lies directly behind, or directly proximal to the first cuneiform? Good. Okay. So which tarsal lies most lateral? What? Cuboid. Okay. I think Andrew's answering all the questions. Maybe you guys are chiming in though too. I think I hear some other people. All right.
Yeah, they're all.
Andrew's just the loudest.
Yeah.
Okay, you're just the loudest. Okay.
I'm obnoxious. I'm sorry.
No, I don't think anybody would call you obnoxious. Andrew, I think the day you brought me coffee, I think you just gained a special place in my heart or something like that. But it's okay, you know, it's totally fine. It happens. All right. Okay, cool. So let's the other thing too. Okay, now what are the 3 arches of the foot? There's 3 of them.
Medial and lateral longitudinal arch.
What else?
Transverse.
Okay, transverse. Yeah, transverse metatarsal as well. Okay, excellent. All right. Okay, guys, you're doing pretty darn well. By the way, last review question for today, kind of reinforcing what we've learned or what we've gone over. What does a sesamoid bone do? What's it do? First of all, how does it form? And what does it do?
Formed from friction.
Form from friction, is he fantastic? Yep. And what's the function of it?
Protects tendons.
Protects the tendon. Okay. And so, yeah. And what else does it do? So you're absolutely right. What does it do for that tendon anatomically, Izzy?
Make sure it runs straight through.
Right. So essentially provides a tunnel for that tendon to run straight through. Okay. And provide a straight line of pull. All right. Okay, guys. So this was obviously a very quick introduction to the foot. You know, any questions about this, guys? I mean, I know that this is obviously probably for you guys pretty elementary and pretty easy, right? we've probably gone over some stuff that you guys covered in anatomy. This is going to get obviously more difficult as the days go on, but don't worry. So, any questions, guys, before we call it a Friday?
I mean, this is kind of a random question and
No.
not at all relevant. Well, I mean, it is relevant, but
Yeah,
kind
what you
of.
got?
If humans were to, in theory, crawl their entire lives, would their patellas just be like massive?
So, it's crazy. That's a great question. One that I don't know the answer to, but I would say that I think it's possible. It's definitely possible. So the crazy thing too, right, is that as we're developing as babies, right, generally speaking, our pelvic bones and our shoulder blades, our scapulas actually enlarge, and or continue to develop because of the fact that we spend so much time on our backs as babies, right, just kind of looking up and stuff. And so that is actually where the vast majority of friction takes place. And so I think that could be possible. Yeah, I mean, I'm not a what's the word? I'm not an anthropologist, so I can't answer that question definitively. But yeah, I think it's possible. I think it's possible. Anything else, guys?
So,
Nope.
All right. So guys, if I remember correctly, let me close this out. We'll look at one thing. So we're going to continue to obviously expand on our anatomy. Okay. I'm going to stop recording.